The Uganda Ministry of Health's Permanent Secretary, Dr. Atwine, has today launched a supportive supervision campaign in various health facilities within the Kigezi Sub-Region. The purpose of this campaign is to monitor and assess the quality of service delivery with a focus of improving health services and ensuring their effectiveness, underscoring the commitment of the Ministry of Health to providing better health care to the people of Uganda. Accompanied by the Director General of Health Services, Dr. Mwebesa, and the Ministry of Health technical team, Dr. Atwine commenced a visit by inspecting Hamurwa Health Center IV, which is located in Hamurwa Town Council in Rubanda District. This health facility serves not only the local Rubanda District community, but also extends its services to the residents of the neighboring districts of Rukiga, Kanungu, and Rukungiri. Dr. Justus Atuhairwe, the facility health in charge, highlighted the facility's expansive reach and its significant impact on the health care of the broader region.
Not only people from Rwanda, but we also receive people from Kanungu, people from Rukungiri, and some people from Rukiga, especially those parts of those districts that neighbor our district. For example, at our outpatient department, on average per day, we see around 120 patients, and on average per month, we deliver around 100 mothers.
After their visit to Hamurwa Health Center IV, the team proceeded to Hamurwa Health Center IV, also located in Rubanda District. Notably, the government has embarked this health center for an upgrade to a community hospital. In 2022, the government allocated a budget of 6.5 billion for the enhancement of this facility with the aim of transforming it into a district hospital.
A place that is being grounded for the establishment of new structures for the proposed hospital of Hamurwa Health Center IV that has been upgraded. Hamurwa Health Center IV has a land title, and its land capacity is around 8.6 acres. So we hope that we will accommodate these structures and even more. My prayer that perhaps we would have some kind of improved facility to accommodate tourists because it is near the Lake Bunyonyi, which is the next to us, and also Guinea Penetrol National Park, which are most tourist attractive areas for this region.
Following their visit to Hamurwa Health Center IV, the team's journey led them to Kisoro Hospital, located in Kisoro District. Despite the hospital encountering several challenges, Dr. Atwine, along with the State Minister of Youth and Children, who is also the Kisoro District Women Member Parliament, officially inaugurated the operationalization of an intensive care unit at the hospital.
I take this opportunity to officially open our new IC unit in Kisoro, and I believe that this has come to create hope. 1, 2, 3.
During their visit to Kisoro Hospital, several challenges were brought to light, including the non-functional X-ray machine, a dilapidated theatre, the absence of an ambulance, and an isolation center. Additionally, the hospital faces the ongoing issue of managing an influx of refugees from Congo and Uganda.
People who need those X-ray services, we refer them to another hospital that is private, that's Mutore Hospital. Yeah.
So they have to pay for it?
They have to pay. The theatre being in a sorry state, it has been a challenge because it is beyond repair. In fact, it was recommended for closure. So now you find that the doctor who's working on the patient is at risk. When the theatre has a crack, it becomes a little bit challenging. Anytime we think that it's going to work, it's going to collapse. So we would like to urge the ministry to do something and rescue us.
Formerly, this hospital was planned for 100-bed capacity, but we receive many cases, so sometimes we have even floor cases, those who are on the ground because of shortage of beds. Here we receive people because of being near the two borders of Uganda and Congo. We receive patients from DRC and those from Uganda also. They come here to seek for services. Currently, at the district level, the OPD utilization rate is at 116. We serve more than the population of Kisoro.
To address these pressing concerns, Dr. Atwine announced the government's commitment to providing solutions. In response to the lack of an ambulance, the government is allocating one ambulance that will serve all healthcare facilities in the district as needed, ensuring swift access to medical transportation. Plans are underway to secure a new X-ray machine addressing the non-functional equipment issue. Additionally, it was revealed that the contract for the establishment of a new theatre has been signed, signifying the government's commitment to providing healthcare infrastructure and services in Kisoro District.
So Kisoro District, we are given, but it will be stationed at Chahafi, I think. Yes. But still it will be able to cover. As I mentioned, the isolation center, we have already signed contract. They will come and construct that. The theatre, we are going to work on it. The theatre of Sanza is in the contract was already signed. The contract is supposed to come. We are shifting our gear on performance money. How you are supposed to receive a report of each one's output at the end of the month, so that we know people who work and people who don't work.
By opening this ICU, we are addressing a very critical need within our community. We shall have our patients, we shall not have our patients being transferred to distant hospitals for critical care. I believe that now, with the equipment that I have seen inside there, unfortunately when I reached in, I found in my father's friend already admitted inside. I believe that they are going to handle the most challenging cases.
Dr. Twine concluded her visit by inspecting Chahafi Health Center IV, situated in Chahafi Town Council in Kisoro District. Nobody Nyamachi for Kigezi Television.